I want to talk about the aspect of trying to examine the nerves of a patient, trying to see how the nerves and the muscles are still connected in a patient and how impulses are moving and how the muscles are actually responding, to the instructions from the nerves. So this is the area of neurological examination. So if I want to actually examine a patient, their nervous system and all, we go on. So you look at things that you shouldn't miss out when you're actually doing the neurological examination. So you could see this is trying to use a pin just to see if the patient is still able to feel pain. So neurological examination in orthopedics, especially because we are an orthopedic channel, is very essential. And you get to access how musculoskeletal injuries can affect the nervous system. It's focusing on motor strength, focusing on sensation, focusing on reflexes, focusing on coordination, focusing on gait to be able to dictate nerve compression. So purpose in orthopedics is you want to look at, distinguish between musculoskeletal and neurological causes of issues. You want to identify if a particular nerve is affected in an injury. So it will also guide surgical decision to make you know the type of treatment that a patient needs. Also help you to monitor recovery. So key components of neurological examination in orthopedics is motor system. So muscle strengthening, muscle strength testings, right? So you compare, how somebody's muscles are still, strong. Tone assessment and observation, where you're trying to look at muscle wasting, fasciculations, and abnormal movements. So sensory system, you are now trying to look at if the person is able to feel touch, if they're able to feel pain, and the rest of it. That can help you know the nerve that is what's affected. You are trying to elicit all those reflexes and look at if there's a Babinski sign. That's an abnormal plantar reflex, right? The coordination and balance, finger to nose test, heel to shin test, all those tests now. The gait analysis, all right? Then cranial nerves, trying to also examine them. So that's what we got for this.